are supraglottis, glottis, and subglottis. Here, T1 MR image and airways 3D CT view. We see here is the ventricle, here is the laryngeal ventricle, the airway. Above the ventricle is the supraglottis, and here is the true vocal fold. And above the ventricle it is four vocal fold, it is true vocal fold, it is the glottis, and from true vocal fold up to the lower part of the cricoid, from true vocal fold below is subglottis. And here is the laryngeal ventricle, above the false vocal fold, this is supraglottis, this is glottis, and below the area is subglottis. Same image, the supraglottis, glottis, and subglottis. Below the true vocal fold is subglottis. And same image, sagittal view. Here we identify the hyoid bone and draw a line perpendicular to the horizontal part of the hyoid bone. The supraglottis and true vocal fold area is glottis, and below is subglottis. And now we go for axial images. And axial images, we first draw a section at the level of the hyoid bone. Here you see the uppermost part of the larynx. It is epiglottis. The midline structure is median glossoepiglotic fold, and two airway is air density areas are belliculi. And here is the T2 MRI. Same, the supraglottis area, the belliculi, epiglottis, and the airway. And now we go at the level of middle part of the supraglottis. Here we see this is free portion of the epiglottis. There is the fixed portion of the epiglottis, and these are the paraglottic space. These are two pyriform sinuses and posterior pharyngeal wall. And below here also the epiglottic fold is started to appear. And below this level, at the lower part of the supraglottis, we see the epiglottic fold, the paraglottic spaces, and lower part of the pyriform sinuses. And then at the level of glottis, how we identify glottic areas in CT scan? First, we see this is the circle area. This is the joint of cartilage. This is cricoid and aritoneal. Cricoid-aritoneal joint. Here is the cricoid-aritoneal joint. When cricoid-aritoneal joint appears in CT scan, it is the glottic area. And below the area, when there is a thyroid gland is appearing, and there is a semicircular or circular ring of the cartilaginous ring, this is subglottic area axial. And component of supraglottic component are epiglottis, epiglottic folds, and false vocal folds. Here is the graphical representation of the supraglottic area. We see the epiglottis, medium glossoepiglotic fold. These are the belliculi, and same in the CT scan. The epiglottis, median glossoepiglotic fold, pre-epiglottic space. This is the epiglottis. This is the midline structure, medium glossoepiglotic fold. This is epiglottis, free margin, supraglottic. And below this level, we also see that here is the epiglottic fold started to appear, the pyriform sinuses and posterior pharyngeal wall, and these areas are pre-epiglottic space, and it is the fixed portion of the epiglottis at this level. And below this level, we see the epiglottic fold, the pyriform sinuses, posterior pharyngeal wall, and pre-epiglottic space. And most lowest part of the supraglottis, there is the epiglottic fold, pyriform sinus. And next, the glottic part will look. Here is the glottic part of the true vocal fold, anterior commissure and posterior commissure. Graphic representation. So the cricoid cartilage. This is cricoid cartilage. This is aritoneal cartilage. This is cricoid-aritoneal joint, and this is the glottic, the vocalis, and thyroid-aritoneal muscle. And in CT scan, we identify the cricoid-aritoneal joint, and the areas is glottic. Subglottic includes undersurface of the two vocal cords to the lower part of the cricoid cartilage, and CT appearance, in axial CT appearance of the supraglottic, glottic and subglottic areas. Here, supraglottic area, we see the glottic fold and piriform sinus. Behind, there is no cartilaginous structure. When we go to glottic area, we do not see the piriform sinuses or glottic fold, but we see the cricoid cartilage here and ariterioid cartilage here forming the cricoid ariterioid joint, the glottic area. And below, we see a circular ring, cartilaginous ring, and laterally we may found the thyroid lobe of hypertense lobe of thyroid. Then we can say it is subglottic area. And in coronal graphic representation, the ventricle above it is supraglottic area, the true vocal fold it is glottic area, and below is subglottic area up to the lower border of the cricoid cartilage. And also same in the CT scan coronal. This is the laryngeal ventricle, this dilated part of the laryngeal ventricle. This is false vocal fold. This is supraglottic. These are the true vocal fold. This is glottic area, and below this, up to the lower border of the cricoid cartilage is subglottic area. Now I am going to laryngeal carcinoma. First, glottic tumors. Carcinoma of the cricoid is the most common form of interlaryngeal growth. It presents early with hoarseness, is easily assessed by direct examination and has the best prognosis. However, involvement of the anterior commissure with spread of the other side worsens the prognosis. Here is a small lesion. Here is a small lesion. The cricoid cartilage, thyroid cartilage, the glottic area. Here is a small lesion in right, true vocal fold, small elevation. There is also, here is a small elevation. This is non-contrast and this is contrast scan, CT scan. And coronal scan shows here is the small lesion, the true glottic lesion, only involve the right vocal fold. And here is the upstage lesion of the glottic carcinoma. We see a lesion in the anterior commissure. The lesion in the anterior part of the both part of the thyroid cartilage, and there is a large extension of the lesion in the pre-glottic area. Supraglottic tumors. These are best assessed endoscopically, but may be shown by their ragged appearance on the plain lateral radiograph. Growths arising in the bellicula or in the ventricle of the larynx may apparent on endoscopy or confirmed by biopsy. CT or MRI may be helpful by demonstrating invasion of the base of the tongue, obliteration of the ventricle, and erosion through the thyroid cartilage into the thyroid gland. Supraglottic cancers tend to spread directly into the upper deep cervical lymph nodes. Here, the laryngeal ventricle, and here is the in supraglottic area. In CT scan, we see this is the laryngeal ventricle, this is true vocal fold, and lesion is above the true vocal fold. It is supraglottic tumor, but it extends upwards up to the epiglottis and bellicula. And also there is the small paralaryngeal extension. There is a tumor of upper stage of supraglottic tumor. We see both side of the right and left side of the supraglottic tumor. There is into the anterior part. The same here is the piriform fossa. This is the first upper limit, upper part, and this is little bit lower part lesion. And in sagittal we see a large lesion into the supraglottic area. We see in left side there is a large lesion into the supraglottic area. And lesion with supraglottic and glottic extension. Here we see a lesion in the supraglottic. Laryngeal ventricle is not identified, and the lesion extends up to the cricoid cartilage, and this is supraglottic and glottic. Here we see the supraglottic area, and here is the glottic area, the glottic mass and the glottic mass. Also in sagittal, a large mass extended from the piriform sinus up to the true vocal fold. And disproportion tumor and lymph node, a small supraglottic mass in the thyroid level, thyroid cartilage level, thyroid bone level, and we see there is a large necrotic different sizes lymph nodes in both sides. Subglottic tumors, these are the least common type. The undersurface of the cord is the usual site of the origin and subsequent involvement of the vocal cord occurs. This region is difficult to assess endoscopically. MRI and CT may help by showing asymmetry. CT is to show invasion of the cartilaginous skeleton of the larynx by the tumor. Here is a graphical subglottic tumor. This is the proglottic fold. Below is subglottic tumor up to the lower body of the cricoid cartilage, and we see in axial contrast CT scan a tumor in the subglottic area. There is a circumferential cartilaginous ring, so it is subglottic area, and also we find the thyroid lobe there. It is subglottic area. The lesion tends to invade the left lobe of the thyroid gland. Another subglottic mass. We see there is a circumferential tracheal ring. There is a mass in the right side of the tracheal wall. Also, there this lesion involves the right lobe of the thyroid gland. There is some necrotic lesions at level 4. Then staging of the tumor. T1 tumor limited to one subsite of supraglottis or glottis. T2 tumor invades mucosa of more than one adjacent subsite of supraglottis or glottis, or region outside the supraglottis, that is mucosa of base of the tongue, bellicula, medial of the pyriform sinus. 3T tumor limited to larynx with vocal cord fixation or invades tissue beyond the larynx, there is a post-cricoid area, T glottic tissue, paraglottic space, or minor thyroid cartilage erosion. T4A tumor invades through the thyroid cartilage or invade tissue beyond the larynx. There is a trachea, deep intrinsic muscles of the tongue, step muscle, thyroid gland, and esophagus. And T4B tumor invades prevertebral space or carotid artery or invades mediastinal structure. Here is a T1 tumor, a small tumor I showed you previously, small lesion in the glottic area. It is a T1 tumor. Another tumor involves both sides of the supraglottic area. Okay, this is a T2 tumor. Here is a supraglottic, glottic tumor, the supraglottic, the glottic involved, but we see there is a subtle lesion of the right lamina of the thyroid cartilage with mild paraglottic extension. This is a T3 tumor. We see patient has tracheostomy, and there is huge air density area within the cervical tissue bed. The patient developed subcutaneous emphysema during tracheostomy. And we go for T4A tumor. There is a large tumor in supraglottic region, supraglottic